demonstration for high volume and low volume evacuation systems. We'll start with the high volume suction system. You can see Sylvie's holding that suction so that the suction is placed on the buccal. We're working in the third quadrant, and so anytime we're on the left hand side of the patient, then the suction tip will be placed on the buccal aspect of the tooth. We want the suction to make sure you're on the buccal and that your suction tip will be parallel to the occlusal surfaces, so you're not resting on the bone in the mouth, okay? And so the bevel then is parallel, rolling along the occlusal surfaces of the teeth. So knowing that we're going to do a restoration on the 3-6, as a dental assistant, you would then place your suction tip first, and then the dentist is going to come in with their handpiece. You can see that Sylvie's suction is placed slightly behind the tooth that we're working on, so she's staying out of the way of the dentist. Okay, the suction then will be activated and turned on. Once you're in the turn it on before you get into the patient's mouth. Turn it on. It's on, so you'll hear the flow of the suction, and then the dentist then will step on the rheostat to activate the handpiece. Okay, that high-speed handpiece has water coming out, so what you're doing is suctioning out the water and the debris from that particular area. Okay, so that would be on the lower mandibular third quadrant area. If we were working in the second quadrant, we're going to position the suction in the same manner, only we're going to go up to the top along the buccal still, okay, parallel to that occlusal surface, and you're going to do that. Now what's going to happen is water is going to pool down the back of the patient's throat, so every once in a while you want to bring your suction tip down to the back of the throat to gather water, okay? And so what you want to do is, she shouldn't be pushing the dentist out of the way like that. She should just come straight down with the suction, remove it, and go right back up again. So you're suctioning, continue to feel clear, you're seeing water pooling down the patient's back of their throat, and then you're going to go down, gather the water, and come back up again, okay? When the dentist comes out with his handpiece to take a break, what you're going to do at this point is do a limited rinse. You're going to wash and dry the area using air and water together. So you put it right into the area where there's drilling, and wash, and then dry the tooth. And then the dentist is going to do an inspection. He's going to look over his ear or her ear, and then proceed to do more drilling if they need to. Okay? And same thing, okay? You're going to go in there and suction. Okay, so again, keeping it parallel to the occlusal surfaces is critically important. Using thumb to nose grasp on that side, because you want to keep the teeth retracted when you're suctioning on that side. Okay, so that's excellent. So now if we were working on the right-hand side of the patient and we were doing a restoration in the fourth or first quadrant, your suction is going to be placed on the lingual part of the mouth. It's going to be beveled along the occlusal surfaces parallel to those surfaces, and again, the dentist handpiece is drilling and you're suctioning with your high volume suction. Slightly behind, as close to, but not right on top of the drill or the handpiece, as close to that handpiece as possible. Always looking for the back of the throat for pooling water at the back, so you're removing that. At this point, Sylvie's using a pen grasp, because she doesn't have to use a lot of retraction to pull the teeth back. So you could use, or could choose to use a pen grasp when you're holding the suction. Okay, so if you want to videotape the grasp, good, okay? So that's the pen grasp. Now when we're doing the anterior sections of the mouth, what you have to identify is whether or not the dentist is going to start his drilling through lingual or through facial aspect. So if the dentist then is going to start his prep through the facial aspect, he's going to put his handpiece on the facial. Your suction then will be in the lingual, okay? And so you'll place your suction at the lingual. If the dentist is going to start his prep through the lingual aspect, you then will place your suction in the buccal or facial aspect, and you might want to put a cotton roll down in that area to rest then the suction tip on the cotton roll. Sylvie will demonstrate now putting that cotton roll in the mucobuccal fold. She's using cotton pliers to place the cotton roll. You can elect to place cotton rolls with your fingers, like I said this morning, but when we remove them, we're going to use the cotton pliers to remove them. So again, the cotton roll is in the mucobuccal fold of the anterior area. You can place now very comfortably your suction tip on that. It gives you a little bit of height, okay, and comfort, so you're not resting on the bone. And then the dentist will then proceed to do his prep through the lingual aspect. The same thing will happen on the anterior maxillary as well. So exactly same principles. If the dentist is cutting his prep facially, you'll go lingually. If he's going to be facially, you'll go, if he's going to cut lingually, you'll go facially and be opposite the dentist, just like that, okay? So again, you want to make sure that the bevel is parallel to the incisal or the occlusal surface and not resting perpendicular, and particularly not resting on the bone, okay? Because it gets really sore if your suction tip is actually on the bone. So you want it to be slightly parallel as you're coming down on that. Okay, and so that sort of concludes the actual use of high volume evacuator system in all areas using a limited mouth rinse.